Hi, I'm Dr. Anna Halpern from the Seattle Cancer Care Alliance, and one of the studies whose results I'm presenting at ASH in 2017 is the results of a trial that we did for patients with acute myeloid leukemia or high-grade myeloid neoplasms whose disease is refractory to initial therapy or relapsed after prior therapy. And we studied a regimen called GCLAM, which is a combination of GCSF, cladribine, high-dose cytarabine, and dose-escalated mitoxantrone in these patients. And we looked at both the safety of escalating the mitoxantrone within the regimen and also the efficacy and toxicity profile of the regimen. We found overall the regimen to be well tolerated as well as efficacious, and we were able to safely escalate the mitoxantrone dose. In our cohort of patients treated at the maximum tolerated mitoxantrone dose, we had a high overall response rate of 60%, including complete remission and complete remission with incomplete count recovery. And we had about 22% of all of our patients having a complete remission that was negative for minimal residual disease, which we know is a very important prognostic factor, especially for transplant. Importantly, 71% of our responders were able to go on to bone marrow transplant after the therapy, which is the only known curative therapy in this situation. We also compared the study to standardly dosed mitoxantrone within GCLAM and found this regimen to have higher overall response rates and better overall survival. And we compared it to other contemporary regimens we use for refractory and relapsed disease at our institution and found it to have better response rates and survival than a regimen called decitabine MEC and equivalent response and survival to a regimen called GCLAC.